Hi, everyone. I am Dr. Michelle Maddox. I'm a clinical consultant for Omni-Biotic, and I am here with Dr. Nicole Kane. She is a naturopathic doctor with a degree in clinical psychology, and she's the author of the forthcoming book, Panic Proof. You can find her at Dr. Nicole Kane on Instagram, and I'm really happy to be here with her and chatting about one of her very cool and interesting cases.
Thanks for having me. It's good to be here with you.
It's great to get to chat again with you. So tell us about this case.
This is Sarah. We're calling her Sarah. I've changed some information to protect her privacy. So we'll call her Sarah today. And she had concerns of anxiety, depression, headaches, insomnia, allergies, blood sugar spikes and drops, digestive upset. She was diagnosed with post-traumatic stress disorder. She also used to get a ton of upper respiratory tract infections. So there's just like a lot this
Mhm.
person was dealing with, a long list. And she was taking Excedrin, half a pill in the morning, and an off-brand Claritin for allergies once a day. And she, in the past, had a lot of self-injurious desires, suicidal behavior. And so she was really struggling with a lot of emotional distress as a result of the trauma. She tried a ton of different things to try to feel better. She'd taken bags of supplements, homeopathic remedies, botanical medicines. She changed her diet. She'd done anti-inflammatory diet. She'd done the paleo diet. She'd done the Mediterranean diet. She'd done keto. She'd done every single diet that was
Yeah.
popular that she could get her hands on. She'd done EMDR counseling, spiritual counseling, genetic counseling, and of course, psychiatric medications. So she was kind of at the end of her rope and she's really struggling. And I've been working with her since 2015. And over the last years of us being together, the mental emotional symptoms were significantly improving. The depression was improving. The suicidal ideation had gone away. She was so much less anxious. But there was a cluster of symptoms that remained, and I called these her sticky symptoms. And the symptoms were that she would get this cold or this flu or this illness every single time she was in contact with her niece and nephew. She got COVID 3 times,
Oh
confirmed by
my.
PCR testing, and she was continuing to self-medicate with the Excedrin, and she was having some digestive upset. And so we're like,
Mhm.
okay, you've done a ton of work. You've tried all of the things, and you're getting some results. A lot of stuff is better, but there's just this layer. It's like her immune system
Mhm.
wasn't optimally functioning. And so when we just sort of step back and we look at the immune system and we look at what regulates the immune system, she's worked on her diet and she's taking the right supplements and she's doing the emotional work, is we got to go to the gut and we got
Mhm.
to really figure out, is there something that's missing in doing the gut work? And so we decided to try her on a clinically tested probiotic, one that's been actually looked at as an entire formulation and not
Mhm.
just its individual
Right.
components.
Yeah. How do they all work together? Because that's how
Yes,
we take them.
we take them all together. And so I wanted something that had been clinically studied to be, as a formulation,
Mhm.
effective at resolving the concerns that she had. And so I did some research and I found AB10 by Omni-Biotic, and it was developed for microbiome restoration and increased microbiome diversity. And
Mhm.
so instead of me trying to like go in and like bioengineer every single component of her gut, it's like if we just give her the bugs that have been studied to work together to do what I want, then I could just get out of the way and let her body do its own thing.
Right.
We did a 90-day trial. Sometimes it takes a little bit of time to see, especially chronic symptoms,
Mhm.
improve.
Yeah.
And so I didn't hear from her actually for 4 months, and then we reached out to her. And, you and I did another interview where we talked about how sometimes no news is good news.
Right.
And I hadn't heard from her in 4 months, and so I reached out, and this is what she wrote me. I'm gonna read it to you. So she said, "I started the AB10 on May 19th, 4 months ago. It seemed to really help. It's worked better than any of the other probiotics I've tried. When I first started it, I noticed I was more physically healthy feeling. My digestion was more routine. I was on a sugar kick for a while. And then when I got on the psychobiotic, I felt like I was more able to stick to my low sugar diet. I was able to choose better and do better. I was also able to reduce the Excedrin dosing. I stabilized quite a bit.
Mm,
I think it's helped me not get sick, and I haven't had any yeast infections since starting it either.
that's wonderful.
Yeah. So the Excedrin thing was huge to me because the Excedrin was helping her in a few different ways. Is it's anti-inflammatory, and so
Mhm.
helped her predisposition to headaches and migraines. But there's also a little bit of caffeine in
Yep.
Excedrin,
Yep.
and it like gave her a little bit of that like energy to like lift depression and give her a little motivation that,
Right.
we get out of like a cup of coffee. And she was able to dose that down, which I think says a lot about what was happening with her metabolism and how her body was sort of shifting. A little bit less need for anti-inflammatories, a little bit better energy so that
Hmm.
she needed less of the caffeine. So that for me was an objective metric that we didn't even talk about for her that got better.
That's awesome. Did you flip her from AB10 to the stress release, the psychobiotic, or was she on AB10 that whole time?
That whole time I was gonna switch her because usually after like 3 months, I'll rotate somebody depending on like what comes up next. But she
Mhm.
was after at 4 months, she was doing better and she wanted to stick with it. And she's again another person I haven't heard from in several months. And for her, for sure, no news is good news.
Yeah, that's
Yeah.
really amazing. Um, Again, similar to another case that we chatted about, starting with a probiotic isn't always one of the first things that you think to do for these particular patients. And sometimes it really is that simple, something so simple can make a large degree of impact. Now, did you do a bunch of other things at the same time, or was it, let's try this one thing so that we can see what happens?
Usually I will do multiple things at a time, but for her, we had done so many different things. And
Mhm.
then we find with her that she's like super motivated. She's like, give me all the things. And then she completely burns out
She gets overwhelmed.
and then she stops everything. So she gets
Yeah.
totally overwhelmed. She burns out and stops everything. And so when I was working with Sarah with this probiotic, that was the one variable that we changed. Is she had been
Nice.
to that point where she's like doing the Excedrin and a couple of other things. And by the way, she'd done probiotics in the past, so she was
Mhm.
like a probiotic savant. But no, this was the one variable that changed.
And that's awesome because it also lets you see not just you as the practitioner, but also the patient, right? This one thing is helping, and therefore they're more motivated to continue to do that one thing versus doing all the things all at once. It's hard to know which one, is it all the things that's helping, or is it just this one thing? And what do I have to continue to do? I work with a lot of patients who are in that burnout mode of, there's all these diet and there's all these supplements um and individually they're awesome and amazing, but for a lifelong continue, sometimes it gets overwhelming, even, for everybody, frankly, even myself, looking at
Same.
my supplement cabinet, I'm like, I don't know if I can do this today. Um, and
Yeah.
so having that one thing and the very concrete, oh, this one thing helped me is huge.
Yes.